Thank you so much, Priya, and thank you, Grace, Associate Professor Ariana, and Associate Professor Krista. That were great presentations touching different aspects of social determinants of health. So just before we go into the general discussion, I will point one or two questions that are very specific to your presentations, and then we take the general discussion questions. Starting with Grace, one of the questions was that apart from the activities that you do as part of your initiative, are there specific activities that members of your cafe undertake in their own communities? Meaning to say they get influence as a result of what you do to implement something similar in their own communities?
Yes, absolutely. So you can find on our website the blog posts as well as the recordings of the speakers who have shared what they've done in their own communities. There's a wide variety of what they've done. We had a speaker who was the president of the Colorado American Nurses Association, and she actually implemented the very first acute care nurse practitioner program at University of Colorado Anschutz. So that was a mix of state policy. She advocated at the state government level, but also implemented the program academically. We've had someone who is the executive director for the Commission of Nurse Reimbursement write a blog for us. That group is advocating for federal policy change for reimbursement for nursing services. We've had the executive director for the Nurse on Boards Coalition. So that's someone who is actively advocating to get nurses on boards in various arenas to influence different policies within organizations. We've had active political campaigners, lobbyists, and people who run for office themselves. We've also had hospital policy level change for an emergency room nurse in Oregon who implemented a new policy for what happens as a response after staff are assaulted in the emergency room. And we've had some nurse practitioners who advocated for local health policy for full practice authority. Just as some examples.
Lovely, lovely. These were great examples, and we can see so many things already taking place. And thank you so much. Just a quick question. Has your work so far influenced nursing curriculum in any way you are aware of?
I personally am not in academia as faculty, but I have influenced personally some nursing education that is academic adjacent, if you will. I've advocated and lobbied for removing DEHP, which is a phthalate and plasticizer, out of IV medical tubing and bags. And I am now part of a working group that's creating nursing education campaign as to what that is and why it's important, and to get the information out outside of California where I currently am. There's also global consortiums of nursing education, notably for planetary health. There is a global nursing school community practice that I join their every other month webinars or Zoom sessions to collaborate with them, even though I am from the practice arena, not academic arena. There are professional organizations that provide entire mini academies for this type of training as well.
Lovely. Thank you so much. I think I will leave it due to time factor and get to Ariana. I know your work is still ongoing in many ways, but see if you have anything to add to this, to respond to this question. After adjusting for salary or financial status, did the researchers still find significant association between obesity and food insecurity, which I know your work is ongoing, but I thought to put it across. And then we have got another question still for Ariana that says, have you been able to include the people, for example, with obesity as co-designers in some of the activities that you do?
Yes, I will start with the second question, which is yes, we do engage both individuals with obesity as well as a community advisory board on our studies to get feedback. And I think pilot work is oftentimes really important just in general in research to get a lot of great feedback from the participants themselves, not only about the research process, but also about what we're providing with them. So we've been able to get a lot of qualitative feedback about the different programs and what they liked and didn't like about them, and then are able to use that for other studies as well as improving the program as well. To the first question, I believe they're asking about observational studies, and the adjustments, I would say, for socioeconomic, it's a little bit hard to do with food insecurity because they are correlated and related. I'm not positive if they typically have adjusted for those that I have seen, though Krista might also have thoughts about that too. I have mainly been in the clinical trial arena in terms of thinking about sort of intervention development and less on the observational side. But because they're so related, I think they are really intertwined and it would be hard to, in a way, dismantle them. So I think there is a relationship, but food insecurity is tied with economic status as well as education.
Lovely, lovely. Thank you so much, Ariana. And I will quickly jump to Krista. Just one question before we get into general discussion. Is there any advice you can give to help prepare nursing students in the work that you do?
Yeah, thanks for that question. And it's something I spend a lot of time thinking about. I think perhaps one of the most important ways to do so, and we've actually published a paper on this, is purely just having students deeply engaged in community-based work as part of their nursing training. So much of our nursing training in the States is focused on clinical experiences and hospitals. Obviously, that's very important. That's where many new nurses begin their career. But having deep engagement in the community as part of their clinical, particularly repeated engagement with the same community setting over the period of a semester or semesters has been helpful in both some of our quantitative evaluation of student progress as well as just anecdotally from students and preparing them to do work focused on the social determinants, with the caveat that students need to be prepared for that work going in. So not something you necessarily want to try with maybe first-year students, but once they're a little bit further along in the program and have a framework for understanding equity and social determinants, and then providing them with the opportunity to spend some time doing deep community engagement as part of their program. I think that can be one of the most promising ways.
Absolutely. Thank you so much. And now open to everyone. Of course, we have had 3 amazing case studies ranging from the mentorship program to food insecurity and school-based program for children obesity. So the most important thing I think we should start is, what are the unique skills or training that nurses require to undertake activities like the one we have had in the presentations today? So if you want to put your hand up and then I will call a name, or you can, just speak up. Anyone? Yeah, okay, thank you so much, Grace. I can see you. Grace, go ahead.
Considering that the cafe helps nurses find a space to build these skills. I would encourage everyone on the call to look up Simon Sinek, who's a thought leader in inspirational leadership. He has a very poignant YouTube video from a TED Talk from 2009, which is relevant today. And it's about how great leaders inspire action. And it starts with everything you do. The core of what you do is starting with your why. So find your passion, find what you're really, really passionate about, and find the intersection of where you can do good in the world for social impact and also what's needed. And whatever's in the center of that is where you're going to find a lot of success. But beyond that, you must find good mentorship. And I would we say that we started the cafe to provide a psychologically safe space, but I like to call it now a brave space because it encourages nurses to think differently about their skills. For example, the nursing process here in the United States, we teach ADPI, right? That is project management, but nurses don't think of themselves as project managers, but that's what we do every day. So think about what skills you already have in a different arena, in a different light, and challenge yourself to use them differently. Think and read and write a lot, and the more you practice, the more you'll be really well suited to be an articulate messenger.
Lovely, lovely. Thank you so much, Grace. These were great advice on the skills and training required. Anyone else, particularly from our audience? Anyone want to speak up? Can I see hands?
Oh,
Yes,
hands.
please.
Okay.
Go ahead. Yeah, go
Hands
ahead.
Oh, I absolutely agree with what Grace just said there. That definitely, you know, having a clear sense of your motivator, your intrinsic motivators, and your extrinsic kind of drives is really important. Having mentors and people that you can see doing work that impacts is so important. And we hope too that forums like this become those opportunities for models of practice at this level to be visible and showcased. And I'm also interested in how the presenters, but everybody, you know, thinks that we can build in the capacity for what I believe is needed, which is a certain amount of courage and bravery, because to challenge the you know, to influence the upstream social determinants of health does require sometimes challenging, quite entrenched policy settings. And so the courage, how do we prepare nurses to have that courage? I guess would be the simplest way to ask that.
Lovely, lovely. Thank you for adding those, Natalie. And I've got Krista. Want to add anything? You are muted, Krista.
Oh, goodness. Zoom 101, unmute before you speak. Okay, now I'm ready. I appreciate both those prior comments. And the one piece I'll add, which is an aspect I think a lot about, is how those of us, given our expertise or our positions of power, depending on where we are in our careers, can help change systems to make it easier for nurses who feel confident, who feel prepared once we have them prepared, to make those kind of changes. Because I know, both when I think of my role as a clinician, but also primarily as a researcher working with nurses in this capacity, a lot of the barriers they face, even when they're acting brave, courageous, strong, they're coming up against so many system level barriers, time, money, lack of leadership buy-in, that it at times leads to them experiencing burnout, frustration, feelings of helplessness in trying to make those changes. So I don't have the answer, but I like to think about how we can work on both ends. We have those wonderfully prepared, motivated nurses who are so passionate, but we're also helping them to work in systems that aren't presenting so many of the barriers that they are in the way our current healthcare system, at least in the USA, is structured.
Lovely. Thank you so much, Krista. Any last thought before I get to the next key question? Yeah, thank you, Ariana.
I'll just add something really brief, which I think is encouraging people who might not be invited to some of these conversations to at times invite themselves, really to, you know, make sure that people are, you know, recognizing that you might not be invited to the table, but you have to sometimes, you know, build your own chair and bring it with you, or make your own table and invite people to the conversation to recognize that nurses are leading in this space and have really great innovations and also implementation strategies to be able to really make a difference in this area.
Lovely, lovely. Thank you so much. Great responses. Just to add a similar question to this, I know you've mentioned some of this as part of your discussion, but I want to hear the audience opinion. We do a lot of work as nurses that influence social determinants of health, clinical, community, schools, and everything. But I think the most important thing is how can our work influence policy that impact the public, can be a hospital, can be an entire country or a state. So I wonder what our thoughts are with respect to how can this work influence policy for the greater good. Anyone who wants to start the ball rolling? Policy, yeah. Thank you, Ariana.
I can start a little bit. And I sometimes think about policy broadly, both from the governmental perspective, but also for things like health insurers. And I think having conversations with them to be able to understand, okay, what is it that you value and what are you looking for in some of these interventions? That way we can add things like different, measurements for things. Sometimes it's about scalability and then being like, this intervention would not really be able to be implemented on a widespread scale. We're going to have problems with coverage of it. And really having those conversations early on in terms of sort of, okay, what metrics would you be looking for, can just be really helpful in order, because sometimes they speak also like a completely different language, like there's terms like return on investment and just things that, economists are involved in, all different sort of individuals where I might not be thinking about that as a clinician. So, making sure that we're kind of having a really holistic view in terms of what their priorities might be, but then also making sure that I'm sharing what my priorities would be as a clinician in terms of seeing health benefits and really helping people improve their health.
Absolutely. Absolutely. That makes a lot of sense. And actually, we have got a comment also in the chat that says the idea of encouraging more nurses to be on board and to lead the conversation is great, which I believe so. Yeah, Priya.
Yes, I just would like to add my thoughts on this, which, as I believe all of us are, thinking about this. And I believe all of us have been thinking about it during the time we have been nurses, which is, several years, decades in some cases. Yeah, so the one thing is, I believe it is important to, especially looking at the novice nurses or emerging nurses, nursing students, it's really important to give them a bit of strategic thinking, because I think that is important in today's world to find a place, to know our place. I think it's really important to know the key people, for example, within Australia, knowing who are the nurse leaders, who are the policymakers who have a say, and knowing them on a, who is who on a name by name basis, I think is important as well. And having the thinking as kind of like a leader, how can I get this across? Because the passion, we do see that we are often, as an educator, I get inspired every day when I interacting with my students, because I see a lot of passion there. But sometimes as experienced nurses and academics and influencers, I believe we have a responsibility in helping them guide, showing the channels. And in today's world, with the modern technology, with AI and everything, I believe this is much more easier than a few years ago. And I believe that that's, in one way, it is advantageous. We are living in a better situation, but on the other hand, we are also living in a very volatile environment as well, with climate change, political insecurities, war going on. And so it's a very complex world that we are living in. And I believe it is important that we encourage our nurses to step up. And I think it should start from the individual level as well. Thank you.
Lovely. Thank you so much, Priya. And we have got some important links shared by Albi on TED's speech, and then another link shared by Ariana. So if you want to have a look, just click on the link. And yeah, let's get one more. Grace?
Yes, but just to quickly add on to the last point made, to emphasize that we need to encourage and teach students how they can be active in this, and get them to think critically about their position when they enter practice, but that they don't have to wait until they're in practice to take action. There are definitely, student nursing associations is the very first and easiest way to get involved, but the youth is really, they're our future, but we don't have to wait until the future for them to act. They can act now.
Lovely. That absolutely makes sense. With our number and everything, I think we can start to make a difference even as students. And lovely. Thank you so much, Grace. Anyone else from the audience thinking about policy? Otherwise, I'll just throw in a very quick last question. I know we're heading to our time limit. I know during the presentation, oh yeah, don't need to wait for till the future to act. We can do it now. Lovely. That's a good point. I know during the presentation, a lot of you have mentioned some of the difficulties, and I believe if anyone wants to initiate any intervention or initiative, challenges are things that we can help it. So I wonder if we can point out some key challenges that you probably had gone through, some of you that have implemented your initiatives, or something just to take in mind going forward if NS is to implement an initiative similar to what you have done. Just quick response, 30 seconds possibly.
I can start. I think
Yes,
for me,
Ariana.
finding funding is always challenging, as many of the researchers know. Being able to provide something for someone. Sometimes I've heard of folks getting sort of like donations of things, but again, finding funding and the resources I think can be really challenging. And then thinking about what that means actually in terms of sustainability for any of these interventions and how it will be funded long term.
Lovely, funding, big issue. Thank you so much, Ariana. Anyone else? Key challenge you can think of?
Dr.
Yes.
Chuti, I'm sorry. Yeah. Let's
Krista,
this will
just
be
one more.
This will be
Quickly.
a final
30
comment,
seconds.
and then we can move on. Yeah.
No problem. I'll be quick. This aligns with some of what we've heard before, but having pride and confidence in your role as a nurse and knowing how to advocate for the value you bring, because sometimes others won't recognize that, but learning how to make the case for why a nursing perspective is important in spaces in which they're typically excluded.
Absolutely, absolutely. And thank you so much, everyone. I'm sorry even for the questions. There is no much time, but thank you. That was a great discussion. Over to you, Priya.
Thank you. Thank you very much to everyone for all the contributions. Very thought-provoking, very inspiring. And I would like all of us to continue the conversation even beyond this symposium. And yes, thank you very much. I'm just going to quickly share my screen again. Yeah, so this is just a reminder, for people who are interested and who have those case studies, which highlights the nurse initiatives or the interventions taken forward by nurses to, submit the case study. And using this link, the next regional symposium registration. So the next upcoming regional symposium is going to be focusing on Africa and Eastern Europe. And the date is towards the end of November, the 22nd of November. And I would like to, encourage people to, the audience to please register yourself using the QR code that is over here. And as we conclude today's symposium, I really want to extend my heartfelt thanks and gratitude to our presenters for sharing their beautiful, invaluable insights, and to each of you for your active participation. Your engagement today underscores the importance of collective efforts in addressing upstream social determinants of health, and also highlights the pivotal role that nurses play in driving the systemic change. We hope you found today's discussions inspiring and are motivated to implement these insights in your own practice and networks. Please remember to visit our website for more information on upcoming sessions. Feel free to reach out to info@stohpractice.org, which is available on the website as well, with any questions. Thank you once again, and we look forward to continuing this important journey together. Please share what you've learned with your networks, and we hope to see you at our next regional symposium.